why we're here. So I actually give the cameras. You okay? Am I blocking everyone? Basically, what I usually do is I go into general practice and I will talk about what I'm doing. This is sort of what I bring into the office, and I've added on to it today. But this is similar to what I do with general dentists and periodontist and oral surgeons. So we're going to talk about SureSmile a little bit. Before I do that, I'm going to show what I've done over the past 5 years as far as my practice. I do practice pediatric dentistry and orthodontics. I do dual practice. I do have an associate, Dr. Al Simthi, who also graduated from the pediatric dental program here. Graduated, I think, 2 years ago. So I'll show some of that at the end too. Basically, what I decided to do was actually create a home practice. Now this is a little different. Also, anyone who's graduating, if I can help anyone when they're finished as far as how to set up shop, what they want to do, how they want to be, and equipment as far as build out, everything like that, there's a lot that's going to happen once you graduate. And if I can be of help to anyone, it'd be my pleasure. But I want to talk a little about SureSmile first. I'm going to show you some pictures of my practice. Basically what SureSmile is, it is a very advanced treatment tool to treat orthodontic patients. What happens essentially is that it is a digital orthodontic treatment planning system where you can actually create robotically fabricated arch wires through very advanced treatment planning techniques. So let me go through it a little bit. I've been in practice for 5 years. I've treated about 700 patients in those 5 years. 40 of them have been in SureSmile. I've been doing SureSmile for about a year, a little over a year. And what I've noticed in SureSmile in those 40 cases that I've done is a very big difference. Not just in treatment time, which is one thing, but in the ability to treat plan and with quality and with incredible acuity, how to get the teeth in the right position. In a very advanced way. This is my home, actually, in Muncie, New York. We call it Smile Builders. That was the name that we thought would be good for a pedo-ortho practice. We're taking kids from ground up all the way through 18 through orthodontics. Thought that was a good idea. Home office is an interesting concept. I probably would not have done it unless I found the exact right space. And we did happen to find the exact right space to do this. My wife called me and said I found it, and I walked in and I looked at it and I said, let's do it. We had about 1.5 years of zoning, and then we built out. In pedo-ortho, I did separate the waiting room, so I have an orthodontic waiting room, or adultish type waiting room, and then we have a pedo playroom, fun room with games, toys, TVs. In the op room, this is we created a simulator airplane type of simulation room. Also on top, you'll see there is a TV on top of the child's head. Also behavior management with TVs, especially once it can get over a child's head, is a tremendous advantage. This is the hygiene room. And we separated on an ortho bay. So I have an ortho bay in the back. So pedo's a little bit separate from ortho. We do ortho in the back, and pedo separated. And this is the staff. You see Dr. Cynthia over here with pedos on the left side, and I'm there with my assistants, and the front desk is at the bottom there. Okay, I want to just introduce SureSmile with a little video. Gives you a little bit of an overview. And we'll let this run, and then we'll talk about it a little.
If you have the news lately, you're going to treatment to get your best and brightest smile.
It's redefining the way orthodontics is done.
The new cutting-edge razors that have teens and probably their parents all about the Family Smile technology has opened a new frontier in orthodontics.
He's talking about SureSmile. SureSmile is redefining the way orthodontics is done. It combines the doctor's expertise with the power of 3D visualization and the precision of advanced robotics. It means moving from this to this quicker than you thought possible. Why do patients choose orthodontics who use SureSmile? or straight teeth and a great smile with less time in braces. How does Sure Smile help your orthodontist reduce your treatment time? You might think that your teeth will move faster, but as we learned in geometry, the shortest distance between 2 points is a straight line. With Sure Smile, your orthodontist first takes a detailed image of your teeth. Those pictures are then transformed into a 3D image on a computer screen. The orthodontist can see and visualize your teeth, not only from the front as with conventional orthodontics, but from all angles to better plan how your teeth should move to give you a beautiful smile. Sure Smile software calculates the wire bends needed to more efficiently and directly move your teeth toward their proper place based on your doctor's plan. That means you spend less time wearing braces. How fast is Sure Smile? Sure Smile has been shown to decrease treatment time by 1/3 on average when compared to traditional braces. A Sure Smile orthodontist can have the average patient out of braces about 8 months earlier. You'll have fewer trips to the orthodontist and less hassle in your busy schedule. It's all possible because once your doctor designs your smile, Sure Smile uses the doctor's instructions to create a customized arch wire that is inserted into your brackets to move teeth toward their finishing position. A Sure Smile wire is made of a unique shape memory alloy. It's bent just for you by a robot at extremely high temperatures, permanently embedding the doctor's prescription in the wire. You see, in conventional treatment, a series of wires are manually bent using pliers, a less precise way to move teeth. But with Sure Smile, all the bends to move your teeth are made in one wire. When it's placed in your mouth, your own body temperature activates it. Your teeth move with robotic precision along a more efficient path to their finishing position, giving you straight and beautiful teeth in less time. A great smile has lifetime benefits. The final position of your teeth is important for oral health. The better they fit together, the more stable they'll be, which means less wear and tear, and in many cases, less dental work as you age. How does an orthodontist know how well your teeth fit together? Most orthodontists evaluate the quality of results by measuring tooth-to-tooth alignment using plaster models. This evaluation is done manually, is very time-consuming, and only performed on select patients. However, with Sure Smile technology, your orthodontist is able to do this for every patient before finalizing your prescription. As a matter of fact, an independent study published in the World Journal of Orthodontics found that patients treated with Sure Smile experienced overall reduced treatment time and better quality results than those treated conventionally. For many patients, Sure Smile wasn't just an easy choice, it was the only choice. Better results in less time. That's why thousands of patients have chosen orthodontists who use Sure Smile.
Okay, so that was a little overview. Basically what happens when I have a patient in Sure Smile is that we have a scanner in the office as part of the Sure Smile process where we actually scan the patient's mouth with the braces on. I'm going to go through this in a little later, but what happens is that after about 6 or 9 months of treatment, when braces are already on the teeth, and you can use any bracket system that you want, we do a scan in the mouth. This can also be done with the CBCT, but I don't have one in the office yet. That can also be done very quickly with the scan, with a CT scanner. In the office, it takes about 45 minutes. We do a series of records, and then we take a scan of the mouth and get a digital representation of those teeth with the brackets on the computer. So what I'd like to show you is I'm going to introduce a little bit as we go along, show you how tooth movement works a little bit with Sure Smile, and demonstrate why I think you can get better quality in less time with Sure Smile. Before we go into it, I just want to discuss orthodontics a little bit, just conventional orthodontics, some of the limitations that I've found over the past 5 years with conventional orthodontics, and then describe Sure Smile a little bit, and then we'll close up. As far as going to a general practice, getting referrals is difficult, and when you have to create a relationship. Besides creating a relationship, they have to see that you're getting quality results in quality time. And when you do that, you gain confidence for your referring docs, and you can collaborate tremendously with this software also, as far as email back and forth, and the reports that you can give to your referring doctors is really amazing. Patients are all obviously happier because there's less time in the chair and less time in braces. And you brand yourself a little differently. If you're doing something different, like I said, you sort of brand your practice, you differentiate your practice from other practices, and that also helps for referrals tremendously. Now, some of the limitations of conventional orthodontics. In general, orthodontics is dominated by straight wire philosophy, which basically means is that if you were able to put a bracket on a tooth in its ideal position and put a straight wire into that bracket on the tooth, a rectangular arch wire essentially into a rectangular slot, meaning edgewise orthodontics, all of the tipping and twerking and angulation is fixed into the bracket. So essentially, if you were able to get that bracket perfectly on the tooth and put the wire in, over time, as you fill the slot, you would actually move that tooth into the ideal position. That is the concept of straight wire orthodontics. The problem with this concept is that not every tooth is the same, not every bracket is the same, and it's almost impossible to get a bracket on a tooth in the absolute ideal position. Like I said, it is totally dependent on getting the bracket in the proper position on the tooth. Every tooth is a little different. Sometimes they're shaped a little differently, the morphology is a little different, sometimes the position of the root's a little different. So the majority of orthodontists are using a preset bracket prescription. In general, you don't have separate bracket prescriptions for each patient. You may change a little bit here and there, but essentially you're using a preset bracket prescription for every patient, which obviously can't be 100% right. So what do? So we, on the bottom here, we bend arch wires to correct for bracket prescription and placement shortcomings. That's in general. At the end of orthodontic treatment or in the middle or some point, you have to do some wire bending. Now that can be done, and it's been done consistently throughout the years in orthodontics, is wire bending. The problem with wire bending is that wire bending is essentially a reactive process, where we bend a wire and we tell the patient to come back in 4 to 8 weeks. That process of wire bending is we see a tooth, we move it, we see what happens next time, we take another movement. There's a reactive process. We see what happens and we make an adjustment, we see what happens, we make an adjustment. Here we can see, before we do anything, we can see every bend can be put into the arch wire on every specific tooth, and we can know where we're going from start to finish. Instead of reacting to what we do, we're interacting from start to finish. And I think that's a big difference. Like I said, we take time to put all these bends in a wire. Robot does this very quickly, but besides doing it very quickly, what it does is it can create a prescription arch wire for every single tooth on every single patient. But it's something I don't think you could say conventionally you could do. This is an example of a regular treatment case. In general, conventionally, it takes about 24 months, sometimes a little longer to do a case. The first phase of orthodontic treatment is called leveling and aligning, which most of us know about. That's the first 9 months of treatment. Essentially, we're getting the teeth straight. You're working on your AP, your sagittal movements. If you have a class 2, a class 3, you're using different things to move things in a basically stable direction where you start towards the finishing stage, which is from about 9 months until 24 months. When you get to the middle, to the end here. That is the hardest part of being an orthodontist. Dr. Chung always used to say it's easy to start, but it's hard to finish. I think that is very, very true. Not just orthodontics, probably for everything in life, but this is the hard and difficult part of orthodontics. This is where you're going to have a child coming in every month and saying, when are we finishing? When are we finishing? When are we finishing? And sometimes it can take time. With SureSmile, you sort of take the guesswork out of it, whereas the first 9 months remains the same, essentially. From 9 months on, we're treatment planning with software where we can actually see how the tooth is going to move based on our bends, and we're getting a tremendously accurate reading on the computer up to 0.1 of a millimeter. And we can grade every case. We can go through every case and grade every case and grade every tooth. And from 9 months to the end is a much more efficient process. Another thing that the robot can do, which we can't, is that in general orthodontics, nickel titanium arch wires have been used for a long time in orthodontics. The beauty of the nickel titanium is that it has shape memory, which means that it will go back to its original form. So obviously, if you put a nickel titanium arch wire into a bracket, it will move it back to the form of the arch wire. If you could bend a nickel, you cannot bend a nickel titanium with your hands. It does not bend essentially unless you heat it. The robot actually, when it bends, throws heat into the wire, so it's able to make bends into nickel titanium, which is something that we actually can't do. I actually brought some wires. I can show them to you. We can send them around. When you order a wire, Sure Smile actually sends you a nice box like this with a template of how to place the wire into the tube. I'll send it around so you can see how nickel titanium works. Besides having shape memory, what will happen is over time it's very gentle. It's gentler than a stainless steel arch wire, and it's constant. You'll get a constant force over time where you can continually move the teeth into their proper position. So I'll send these around. You can use any bracket system. You can be used for. There is a library of brackets, like thousands of brackets you can use. It doesn't make a difference which bracket you use. As far as Sure Smile, there's a bracket system for any patient that you want to use, any kind of bracket you can use. Like I said, you'll compensate for bracket positioning error, and it will eliminate manual wire bending essentially. I'm going to go through the process a little bit of the digital imaging, the treatment simulation, and then the customization. So what happens is the patient comes in. The oral scanner, like I said, is a scanning device you saw in the video. It's just got a 3D camera. You have to paint like a blockout material onto the teeth, and then you scan. And like I said, it takes about 45 minutes. With a CBCT, it takes about 15 seconds, which is a big advantage to having it. Once we get the scan, it goes to Ormetrics, and they send me a therapeutic setup model with the brackets on, just like this. And then I see, does it correspond to my records that I've sent them? So I want them to see if the model that they send me corresponds to my patient to make sure that it's right. So we'll go through a detailed process of making sure that the brackets look in the right position and the teeth look in the right position. Like I said, the robot can customize for any bracket placement errors that we put in that we have. Also, you can put any type of tip and torque into the arch wire to compensate for the actual slot of the bracket. And like I said, you can bend nickel titanium arch wire. I just want to show this video a little bit about quality grading tools. Also, once you get the wires back, once you're there.
With Sure Smile, you can look at a setup or a final model to quickly and easily evaluate your treatment plan with the quality grading tools and software.
There's a long checklist that you go through.
Before arch wires are produced, you can prospectively target a high-quality outcome by evaluating the model with grading tools. To evaluate discrepancy, simply click to be taken to a detailed view. Here, this tooth is not in the correct position and is causing a poor quality grade. We'll make an adjustment to the model and check the quality score after the change. Sure Smile makes it easy to continuously improve by allowing quality measurement for every patient.
Just one more about the measurements. You're going to get an immediate, when you send them out, you get immediate
Sure Smile provides
two-side measurements.
precision measurements and tooth movements for control throughout the patient's treatment. You'll have the ability to see things you couldn't see before.
Use the Bolton analysis and tooth width measurements to plan space management and IPR.
So what you actually can do is you can actually get an immediate Bolton analysis, which is a tooth size analysis. You get that done immediately. All the tooth sizes are done immediately. You can check arch length discrepancies, crowding, and you can plan for IPR. Very interestingly, I wanted to show this IPR video also. Interproximal reduction is something we all do, I think, in general dentistry, pediatric dentistry. And orthodontics is done commonly, but to know how much to do and exactly is difficult. And with these tools, what happens is that you can actually clip through the teeth. As you clip through the teeth, you can actually see where the overlap occurs, and it's measured exactly. Let me show you that.
With SureSmile, you can plan for IPR. Use the clipping plane tool to see there is built-in IPR to this treatment plan.
So we're clipping through the teeth. You'll see the overlap.
You can see here the teeth overlap each other. On the lower teeth tab, you can see there is an intersection of 0.2 at each contact. Select where you would like the IPR performed. The IPR will automatically show in the model in red. You can now see all of the planned IPR, whether it be the mesial or the nasal surface of the tooth.
It's also a very nice feature to be able to see exactly how much IPR you need. As you clip down through the teeth, you get an automatic reading of the exact millimeter measurement of how much IPR is necessary. I did want to show this also for the surgeons. They do have a very, very nice surgical component to the software where you can actually simulate surgical and all the surgeries. You can show pre-surgical, post-surgical setups. You can make the surgical cuts, and you can really correspond with the oral surgeon very nicely.
You can use SureSmile to plan for one-piece or multi-piece surgery.
All the references are always at your
Choose
disposal.
any plane of reference. Note the arch length discrepancy resulting from mandibular advancement. For this patient, the doctor is considering 3-piece surgery in the upper jaw and 1 piece in the lower. You can choose the location of surgical cuts. Simulate segmental surgery. You can align an individual tooth in any of the segments. Here are the total movements planned in the post-surgical setup. You can easily collaborate with your surgical colleagues with SureSmile surgical planning tools.
Okay. I did want to, that's also a very, very nice feature. I wanted to show you something. This is a little more for the orthodontists, but I put this slide up here to show you basically what, once we get a wire fabricated. So again, I've done the scan. I have a model that I look and make sure everything corresponds. And we go through a treatment plan, and we go through a process of treatment planning the patient. Once the teeth are moved in the positions that I think are ideal for this patient, I press the button, and the robot goes to work making the arch wire. When the arch wire is sent to me, before I get the arch wire sent to me, I look at a dispensation tab like this. So what you have is, if you go down, you can show every movement. Let's focus on one tooth here. Let's focus on the upper left one, the upper left central incisor, right here. This is pre-activation, and this is post-activation. So we're going to focus on this wire right here, and this slot right here. So this is before the wire is put into the slot of the bracket, and this is after. This is before the movement was made. This is after the movement is made. So let's just take, if you look here, we're looking at the upper left one, and we can look at mesial distal movement, buccal lingual movement, occlusal gingival movement, torquing, angulation, rotation, and what's going to happen by doing these movements. Mesial gap, or IPR, if you are doing a movement, for example, if you're rotating a tooth and it can't rotate because of a space issue, it will automatically come up that you need to do 0.1, 0.2, 0.3 millimeters of IPR in order to rotate that tooth properly. So let's just go through it quicker show you the exact, how you can be exact with every tooth. So let's take the upper left one, let's focus on this tooth. And minus 0.1 millimeters on the upper left one, mesial distal movement. We're going to move a little bit distally when we move that tooth. Buccolingually, we're going to be 0.4 millimeters, a little bit buccally. So you can see the arch wire is actually out a little bit here. If we put it into the slot, the tooth is going to come forward a little bit, 0.4 millimeters exactly. Occlusal gingivally, we're going to actually extrude this tooth a little bit. So if you look, it needs a little tiny bit of extrusion. If you look at the arch wire, it's actually sitting down towards the bottom wing of the bracket here. If you were to engage it, as you do here, the tooth will now come down up 0.4 millimeters exactly. And we're doing a little bit of torquing, so we have 2 degrees of facial crown torque, and we're doing a little angulation. We have, we have no torque on this tooth. When we go to rotation, we have a 4 degree mesial in rotation. So we're going to rotate that tooth in a little bit mesially, and then and that's it. So you see, for one tooth, we have 5 different movements that are being created in an arch wire with multiple bends on one tooth, getting us from this position to that position. If you can see here also, there's these little laser markings here. You'll see on the wire that I'm sending around. The laser markings show you exactly where to place the wire in the tooth so that the bends are in the exact position on the tooth. I just want to show you the exactness. We just went through one tooth, how you can go through exactly how that tooth is going to move to the 0.1 of a millimeter in all directions and all planes of space. Again, what you plan is for what you get. This is sort of the SureSmile cases, but basically go through them a little bit. It should, like anything, the digital world doesn't always correspond to the real world. So there is a process of learning curve, which you go through for the first year of treatment, getting to understand how things work out digitally, and then hopefully that seeing how it works out in the mouth too. There is refinements that sometimes are necessary, just like any cases. But most of the time, the cases play out the way that they do look on the computer. And just go through some quick cases that SureSmile did. The ideal of the speed is that we're very effectively going from point A to point B, and not having issues along the way as far as reacting to problems that are created through arch wire bending. The AP movements you have to do, any class 2 or class 3 movements, would have to be done prior or during SureSmile treatment. That part of it is still going to take the time itself that you need in general for your AP movements. So at this point, mid-treatment, when the braces are on, this is when we would do the scan at this point. and we get our archwares back. By the time you get the archwares back, usually there's 6 months and you're finished, essentially, 4 to 6 months. And the same idea, if you have a Class 2 type of case and you're using a Herbst appliance or any type of Class 2 appliance to correct Class 2, that has to be done first. So you're going to have this patient in orthodontics for a little time first. Once braces are on and we're closed, we corrected the AP. You see the overjet is a little better here. We're going to start our scan. We're going to get our wires, and then we're going to finish it off. It's also nice having that confidence that when staff can just put in wires, you can move through, patients move through the practice a lot faster, and when the wires lock in and you see how the teeth move, it's just incredibly efficient. You do get a practice stat sheet sent to you that show you your regular cases and Sure Smile cases and the times and the differences, and you can show this to general dentists too. It's kind of nice. So as I said, the benefits are we're reducing risk to the patient. Well, because it's less time in braces, all the risks can happen for more time. Can create more problems. It's more precise. We can do things for each individual tooth that I don't think we can do with regular conventional orthodontics. The benefits are, we're using a tool that allows us to do something that's incredibly accurate, and we can get our patients back to the general dentist quicker, which is nice. And people trust us and see that we care about our patients and what we're trying to do with them. Patients really want the aesthetics is obviously, and want the quality, but they want the convenience in general. What patients really want is convenience. And you'll notice that in your practice, they want to get their appointments when they want and get out as soon as possible. There are peer-reviewed articles on Sure Smile, which you can look up. Also, they do have a lingual system. I'm not doing a lingual system, but with Sure Smile, it's very nice if you're doing any lingual orthodontics. This makes it a lot easier getting these wires that go lingually. And then, like I said, the benefits are it's less invasive to the patient. We have reduced number of wire adjustments. Essentially, when you put in a wire, it takes about 10 weeks for it to play out. So we're seeing our patients every 10 weeks rather than 4. So you have less time, obviously. More people can come into the chairs. We're seeing patients 4 to 6 weeks rather than 10. You can see a lot more patients. And again, the interactive nature of it, where you can show a patient how their teeth are going to move before they move, is pretty a wow factor for them. Okay. Does anybody have any questions about Sure Smile? I was going to show my first 10 Sure Smile cases and some of the things that I went through, and then we're basically going to finish. I also tell the orthodontic residents a few things that I picked up along the way that you can look for. But this is one of the first cases I did with Sure Smile. If you notice one thing, if you see in the lower incisor, that's some gingival stripping, the lower incisor. The one thing you want to do if you see this type of crowding and some gingival stripping on the lower incisor, you want to make sure you really inform the patient and the parent about all the things that could possibly go wrong in treatment, that they will need to see a periodontist for possible graft. So when we finish, you can see that we finish it with all that space, with all that crowding. There was some gingival stripping on the lower incisor, and she will have to see a periodontist. But this was one of the first cases I did. In general, most of the cases that I did, when you put in the Sure Smile wire, they're about 4 to 6 months and finished. And usually it's 1 or 2 wires. What's also nice about Sure Smile is that if you have a very intense bend on a certain tooth, in the software you can actually get it down to 50% of the bend. So you can go down 50% on one tooth, 100% another tooth, 50% another tooth, and then go slowly into the archware and bends that you need. This was another case. Also, if you for the residency, you're going to see hypoplastic and you have to inform parents that this does not get better with orthodontic treatment, and it does not get better, and you have to tell them 100%. Otherwise, at the end, it's going to be your fault. That's really important. Informed consent and informing all the things that can go wrong and what can happen during treatment is incredibly important. And that was also most of my first 10 cases in general worked out very nicely as far as just once I put the first smile wires in, I was pretty much 4 to 6 months and out. Another thing that I learned in practice is retention is a whole separate field. And when you see teeth like this, a lot of things I didn't do early on that I really should have is permanent retain. When you see teeth like this type of crowding and rotation, especially upper incisors and lower incisors, you should really try to permanently retain these cases. Also, peg laterals is something you're going to see all the time in orthodontic practice. You have to inform parents that it does view out at the end, like there is some space, mesial and distal to the lateral, to the incisors, to the upper lateral incisors. Make sure that you inform parents about that also. Also, cases that look simple, like this, are not. And there is no such thing as an easy orthodontic case. That's another thing that I've learned over the past 5 years. When things just look similarly cosmetic, when you have a little bit of an open bite situation and a little bit more of a cosmetic case, these are sometimes the hardest cases to do. Because everyone expects it to be easy as far as parents and patients, and it's not as easy as to control as they think. But we got a nice result there. Similar to this type of case, looks easy, but in the end, to get this really nice is difficult. Also, these types of cases, a little more class 3, a little open bite situation, difficult to control also. This is one of my favorite sure smile cases because it really locked this case down. I was having trouble finishing this case, and I did one arch wire, and I got to this, which I was very happy about. Similar class 3 situation, a little more difficult, but this was also a little bit of a struggle to finish this case, and then sure smile one wire when we got to the finish line. I just want to show you this case. Sometimes the cases like this also, when you have this much severe crowding in the anterior, you really want to permanently retain this type of case, otherwise you'll see, even if you finish nicely, you'll see that you can have relapse will occur, and it's very difficult to control unless you permanently retain. That was finished. I did want to add in a couple of things as far as we're all going to see in practice, and we'll finish, and I can open up for questions. But basically, this is something that we're going to see a lot on the PO side, general side, ortho side, is that the upper first molars are trapped underneath the primary second molars. Happens a lot, and I'll open it up to you also. I don't have a great answer for this problem. I've tried a number of things that haven't had great success, but this is one thing that I did that did work, but it was very difficult to do. So this is an appliance that is a distalizer where we actually bonded buttons onto the occlusal surface of the upper first molars. And there's a spring, I don't know if you get, the spring is activated underneath the button. So one difficulty here is it's very difficult to bond and get that spring underneath the button. Bonding of this tooth is very difficult because close to the gingiva, you have a 6-year-old who's a little bit squirmy, and trying to get that to stick on is not easy. And activating it is a little difficult too. This one actually worked out, but this was a big struggle in this case. This is after you see the buttons on the teeth. We did gain enough space for the 6s to actually squeeze past. And that was the finish. So we were able to erupt these teeth, which was nice. But I haven't had great success doing this. And so if anyone has any suggestions, I would appreciate it. I usually end up holding it with the space maintainer later on orthodontically distalizing when I'm at a later stage. That's what I find to be the easiest for me. This was something Dr. Simke did, so that I showed the pediatric residents I thought was interesting. Similar situation. He actually hemisected the second primary molar, and if you can see, he did actually a Fuji restoration there, a really nice restoration. And you're going to lose a little bit of space there, but it holds it enough. I just wanted to show you something that he did I thought was very nice. And That is it. Thank you for your time.
We have questions for Dr. Weisberg.
Actually, I have two questions. It was a very impressive presentation. The first question was, I just assume is the initial treatment planning would be more time consuming in compared to the conventional orthodontics. Is it? The second question is, cost-wise, what would be to the patient in compared to the conventional orthodontics?
Okay, so the treatment planning, I actually went back to residency for my first year doing SureSmile. That's how hard it is. It was a really big transition. Each patient would be sometimes hours, honestly. Getting used to the software, showing, if you're looking at every tooth and every bend, how things can happen and what the side effects are, it's hard. It does take time. As you see how the wires play out, the treatment planning gets more and more relaxed because you realize how things start to move properly, how it works in the digital world, how it corresponds to the real world. But in the beginning, the first 6 months, it is a lot of time and a lot of effort. It's relearning a lot of things that you got in residency, but in more detail. So that part was hard. Cost-wise, I increased my costs across the board about $700 just to cover my costs. And I did it for everyone. I don't treat everyone in SureSmile yet in my practice. I still do conventional. I choose the cases that I think, like I said, because the treatment planning is so time consuming and it does take time to get used to the software. And they also recommend this too, SureSmile, is that you slowly ramp up to a full practice transition over a 2-year period, let's say, and you select the cases that are, as you go along, that are going to be easier for you and work your way up little by little. But there definitely is a learning curve that does take time. And like I said, I just increased the across the board, didn't change anything, and then, I told people about it, and it didn't really affect it too much.
Any other questions?
Yeah.
I also have 2 questions. Did you change your actual bracket system to like maybe a sort of cheaper or less prescription bracket?
Yeah, you could change your bracket prescription. You could. I didn't do that. I essentially think I kept the brackets that I liked the best, and I still try to get the brackets on the teeth in the most ideal position as possible. And I just use it as a tool that I think just gives me the ability to do things at a little higher quality, a little higher level. So I didn't change anything as far as my brackets. You could essentially buy $1 brackets with your SureSmile, but I think that in practice you want to keep what you like, what feels good in your hands, and that part didn't change, but you could essentially.
And what provisions does SureSmile make to for a non-compliant patient that loses brackets?
So again, those type of patients are maybe not good candidates for SureSmile.
That would be contraindication.
Contraindication. Yeah, a real difficult patient, behaviorally difficult or non-compliant bracket breaker, that's not a SureSmile patient in general.
How can you get the scan?
So it's a one-time scan. Once you get the scan, you basically have them in the computer. You can do anything you want with their teeth. Essentially, you have the ability to go back in and order new wires at any time you want. There's no extra charge for new wires. Once you get a case, you can get as many wires as you want, and you can just keep going. If you have to make refinements, you can go back in and make your refinements, which is nice. Also, chairside does take a little more time because if you see something chairside on the computer, you now have it, and now you can make a digital movement on the computer, and you can see what the wire does, and you can look at the mouth, and you can say, yes, that's what I want to do, and you click, and they'll send you a wire in 2 weeks. That's basically how it works.
Given the speed of this treatment, do you find any difference in blunting of the agency?
No, in general, the speed is not because we're moving teeth faster. It's just moving teeth more efficient. That's the idea, is that essentially we're getting, like I said, from point A to point B more efficiently with a arch wire that has constant memory, and it's in the right position. And from the point of putting it in to the point where you get to the finish, it's just more efficient. It's not actually moving teeth faster. So I haven't seen any problems as far as root resorption.
I have a question, Mike. As you know, I was in orthodontic practice for many years, and when I presented a case, your case usually done much more rapidly than we do normal orthodontics, so you shorten the time. When I presented the case, I would tell the parents it's going to take 24 months and it costs us $3,000, and we're spreading that over 24 months, and they'd say, no, I can't pay that in 24 months. I used to say, well, let me read your child again. You know, you're right, it's going to take 34 months. How do you overcome Going quicker and increasing the cost.
That has been a little bit of an issue. I mean, I basically kind of just grabbed onto the fact that we're doing high quality work. I took the treatment time down and the payment time down to 18 months on everybody across the board, because I didn't want to be in a situation where I finished and I had to try to collect once I finished. So I went down to 18 months on everybody, and I just present what I think is the best thing for them, and hopefully they accept it. I can't say I haven't lost patients because of it. I don't think I have in general. But.
Okay, one more question.
Just a quick question. Great presentation. My hat's off to you. You survived my money for 5 years. That's one quick question to you.
You're not finished yet.
As a pediatric orthodontist, you say that you show this to your general dentist, etc. around the theory. How does that affect your referral base, the fact that you're a pediatric dentist along with being an orthodontist?
Okay, so I think it does affect your referral base. I don't know how much it affects your referral base. What I tried to do is I tried to create a relationship with 10 or 15 general dentists in the community where they would trust me enough to know that they're going to get their patient back. And I just say, if you send an orthodontic patient here, you always get the patient back. They won't be retained for pediatric dentistry or any regular care. And once you do that a few times and they begin to trust you, it works out okay. But it does take time to create that trust, and you're not going to get, I'm probably definitely, they're more apprehensive for sending patients than the regular orthodontic practice. But then you have the benefit of having the in-house referral source of the pediatric practice, where it might augment the referral source.
Michael, that was a great presentation. Very educational.
I want to thank Andrea Weissman also coming. She's been mentoring me for the past year with SureSmile. They do have a tremendously great support system for your practice, where they come in, they help you, they show you how to do a lot of the treatment. You actually go down to Texas and you train with them also, and they're there for support. If anyone has any questions for her, she'll be available to talk to you. And thanks for having me. I appreciate it.